Hi there, I'm Dr. Nicole Rogers, a hair transplant surgeon in New Orleans, Louisiana. And today we're going to discuss what are your options if you're unhappy with a linear donor strip scar or FUT scar. Once in a while, patients will mention that the hair, if it gets cut too short, the donor scar can be visible and they feel self-conscious. Sometimes if they're wearing a ball cap, maybe the cap will ride up a little bit and that linear scar is exposed. So what are your options in these situations? Well, there are two very good options. The first and least invasive is to do what's called scalp micropigmentation, and that's where we use tiny deposits of ink tattoo to basically camouflage the appearance of that linear scar, and it can be very helpful, and we're usually pretty good at matching the color of the surrounding hair follicles. The results with that are seen fairly immediately, although it does usually take 1 to 3 sessions in order to get the best retention of the ink pigment. The second option is to do FUE, or follicular unit excision, into the donor scar, and that's where we use a handheld device to remove individual 1 to 4 hair follicular units and then place those carefully back into the linear donor scar. Now, with that option, you do have to allow 6 to 12 months, as with any hair transplant surgery, in order to see the full results. Some patients will opt to do a combination of both, and that can also be helpful as well.